here we are in your clinic, and your name?
My name is Dr. Pakula. I'm owner of Vita-Health Wellness Center in Regenerative Medicine. I'm practicing in Pembroke Pines, Florida. In my specialty, I'm licensed acupuncture physician, state of Florida. Forgive my language, I'm Russian. And back in Russia, I'm medical doctor, neurologist, and regenerative medicine and sport medicine doctor. I'm practicing in both countries, America and Russia, and I'm proud of myself. I restored my old licenses last year, and now I'm stabilized there. Back in Russia, Ozone Clinic in St. Petersburg.
So, doctor, why did you get into ozone therapy? We are going to talk about how ozone therapy can help those nurses and other practitioners, but how did you get into it?
Basically, my husband started functional medicine, and I always been interested in the natural health. And back in Russia, like I mentioned to you, 20 years ago, I practiced integrative medicine as well, because I was neurologist. And we did a lot of neurological disorders back in hospital. I was introduced from Professor Peretyagin from Nizhny Novgorod, Ozone Therapy, and we went to several conferences with him, and they doing ozone. That's why I become interested and found Dr. Schellenberger in the United States.
Fantastic. And what is your finding is your specialty that you love to use ozone because you're getting such good results?
Well, basically we're using the Russian method, because I mentioned I'm Russian, and Russian method it's a low dosages of the ozonating saline solution. Also we do major autochemotherapy and ultraviolet irrigation for autoimmune disorders. So, but I have the best results with the saline solution. That's why I hardly recommend all my patients, because the molecule of ozone introduced to your body like a huge amount of molecular ozone. Instead, you take the major autochemotherapy and introduce ozone into the blood.
So wait, let's talk about the difference, because everybody knows about the major auto, and the saline they don't know as much. So let's explain first to everybody, what is major autochemotherapy?
The major autochemotherapy, we take a certain amount of blood, let's say 100 ml of blood, and we introduce to ozone gas, which is O3, into the blood, mixed with the blood, and we bring back to the patient that blood. That's a major autochemotherapy. Also, I've been using in Russia very simple method with minor autochemotherapy, which is take the only 5 ml of the blood, mix with 5 ml of the concentration, depends of condition. Let's say if we work on acne or detoxification, we do one dosage. When we do the autoimmune disorders or rheumatoid arthritis, for instance, we do the high dose with small amount of blood, and we introduce into the muscular. That's called minor, and a lot of people cannot afford it. Major autochemotherapy, they come 2 or 3 times a week for minor, and they have a great result.
So this is the Russian method of the saline ozone therapy.
Yes, exactly.
Okay.
This is Russian method of ozone introduction to the body ozonating saline for the patient. So this is a generator when I brought from Russia. Why it's good? Because a Russian method, it's low dosages of ozone therapy. For instance, a lot of scientific study, and I know people mention about cancer. We don't treat cancer, but we help people with chemotherapy to boost, modify immune system, and have a procedure with chemotherapy without any side effect, because we need low dosage. Unfortunately, in the United States, you cannot find low dosage generator. That's why I brought that generator from Russia. Actually, it's from Nizhny Novgorod, like I mentioned. So, and we can see down below the 1 microgram. That's the dosage how we can able to do that. So, in generally,
And so, doctor, you will be training others who want to learn this method.
I would love to train and share, because more people know about ozone, more people can be doing some preventive medicine.
Yes.
So you can hear the weird noise. That's exactly generator start work. And also I'm looking for good generator who has a glass inside the
so not all generators have glass?
No, not all. That's why we're looking one of the best. We brought from Russia, we brought from Spain, and Civical, it's amazing because they have internal, same this one, calculator. So, because I know longevity has separate calculator and you have to purchase separate, but it's cost very, very expensive.
I see. So this one is all inside at once.
It's all inside the one.
Okay. And then you have the tubing.
And we have a special glass, which is the put the saline. We have also here destructor, and we're doing this generate the ozone. Ozone came from the oxygen tank, going into the machine and create the O3, and that's what we have right now, ozonating saline, how it's work. And we arbitrate that for 10.
So let's just take a close-up look. So
Yes.
this is ozonating
saline.
saline.
Yes.
And then this what goes into the people.
Yes, this is what how when we prepare first, and they're going to the our people. Why it's I think it's the best, because it's safe. A lot of people don't like messed up with the blood. We have many people who is religious and they cannot take the blood out the body, and that's why I introduced the saline. We want to be safe, and my goal and my husband's goal do not harm the people.
Right. And are you getting better results with the saline versus the MAH?
Depends of condition. Like I mentioned before, autoimmunity and Lyme disease or the rheumatoid arthritis, we treat with the AMH, high dosage, and ultraviolet. But other cardiovascular, diabetes, I'm not gonna name it.
No, we don't name it.
No, we don't name it.
So how long is the procedure for this?
This is procedure between 20 to 30 minutes.
Oh, okay, like
So,
MAH.
Yes, like AMH. And the recommendation to do between 200 to 250 only saline into the body.
Okay.
So it's a huge molecules. During the 20 minutes, you constantly have that ozone into the blood.
And how much do you charge for a session?
If 150.
150, and for the
Yes.
MAH?
For AMH, 275. But if people have the packages, we definitely give a good discount.
Yeah.
Because obviously you need to have several treatments.
So let's talk about if there's any side effects, or what are you really seeing benefits of using the saline ozone?
Well, first of all, it's no side effect at all. But we have, beside that, we have an excellent result, because we have see in our clinic professional soccer player. Before performance, they doing the ozonating saline, and next day their report they have excellent results and they great they play. We provide the service in Vita-Health, like detoxification with the ozone sauna. What is the ozone sauna? It's a chamber which is the create the heat into that chamber. Patient sitting inside the sauna, and through the tube we have another side of the room. We have a generator which is produce ozone and introduce into the body. People get sweat, and when they open the pores, ozone penetrate into the pores, and that's how the people detoxify. Many times when the people get out of the sauna, first of all they lose like 600 calories in one procedure. Normally between 25 and 30 minutes that procedure. And when the people coming out of this procedure, in a white towel, we see the black marks, which is the detoxification for heavy metal. And that's already been studied for many times. That's black spot, it's definitely heavy metal.
Are you using a different type of ozone generator with this one?
No, we're using the longevity generator.
Longevity, okay.
That's how was introduced with longevity from Canada, and it's great for that tool.
Fantastic. And so when they get out, how do they normally feel?
Normally, we don't recommend to take a shower for 24 hours, and normally people feel lighter. It's also as a detoxification. Beside the detox, people have like a fibromyalgia, the pain is gone. So people with obesity, they feel lighter, and they claim that they feel fantastic.
So 35 to 45 minutes.
No, between 20 to 30 first procedure. You cannot be in heat, and heat can be depends from 105 to 110, depends on sensitivity.
So it's a steam heat.
Steam, yes.
Fantastic. And so how many times do they normally come in per week?
Well, normally I recommend to have a great results. It have to be statistics, so every 3 times a week, minimum twice a week.
And what do you
for
charge?
10 treatments.
What?
We charge $50, but if a person we recommend, they purchase the packages, definitely we're doing this 15% off.
Fantastic.
Ozonated water.
Okay, how do you make it?
So we put the distilled water in the cylinder.
So you use distilled water?
Distilled water.
Ah.
So we use the distilled water, and we use Promo Ozone, right? So I bought this equipment from them. They are excellent, and excellent supplier, and excellent people. So I use this cistern, and for 20 minutes we are sterilize this water, and we recommend to take the for patient. If people has some bacteria, fungal infection, bacteria, stomach, I tell you a story about my wisdom tooth extraction, and I have an abscess. So I did myself, first of all, because I am always doing myself some experiment, I did high dose of the ozone injection myself into the gum because it was really, really bad. And doctor want me to put in a severe antibiotic. I against it. So, and basically what I can do for easy way, so I take the syringe of the ozone as well, and what I do, I treat myself with my abscess. I put the ozone into that syringe and apply into the mouth and raising like that. So that's how I sterilize my after surgery cavity. With the ozone, I also treat polyps of signs and introduce into the nose. And people say after 2-3 treatments, polyps is gone. That's also we do insufflation, rectal insufflation.
Yeah, let's talk about the colonic here. So
ear, nose, it's also.
So you have the colon machine here.
Yeah, but should I say I don't do this?
Yeah, no, because we're looking for people to come here and learn. Because
Right.
why? So I'm a strong believer. I used to be a colon therapist, and I'm a strong believer as well.
Yeah.
That is very important to do colonics. Yeah.
Right.
So let's talk about that. When you do a colonic and you put ozone in there, how does that work?
So when you do colonic, so and we are of course. Should I bring that to everything? So
Everything.
I'm not gonna open. I'm just gonna show. Right. Right.
Okay.
So when we do the colon hydrotherapy with the ozone therapy combined, so when we do the regular speculum and we connect all ozone colonic machine with a special tube, with the 3-way tubes, introduced into the ozone generator, ozone constantly going into the machine, into the spatula, and where people, same thing like you do procedure, when they do feel discomfort, I just press the button and stop water.
Simple.
That's simple. And
Why is the ozone so important to do for the colonic?
well, we know the colon has a direct pathway to the liver, and we detoxify. And when you have introduced the ozone to the colon through the portal vein, you go directly go to the liver. That's important to have a detoxification.
And what kind of results are you seeing with people when they do it that way?
Majority of people who want to do detoxified, I see the people who has like even psoriasis, they have a great results. People with the IBS, they have excellent results for that. Well, for immunity, we do people who has a low immunity, we do the insufflation ozone, direct ozone into the colon. But you know, if it's colonic, it's very important for detox. If you add the additional ozone, it's going to be benefits. Constantly you have oxygen going into the colon. In our clinic, we also do different procedures, for instance, inhalation through the olive oil. We connect to the ozone generator in people in health. It's a help with the sinuses, allergy, cold and flu. But I have a really good results for fogginess in the head and dizziness of people who is introduced the ozone directly to the ear. After procedure, 3 or 7 minutes, depends of the therapy, people claim they have immediately clear up their thinking and how it's going into the water and introduced into the ear. It's great.
So now what is ultraviolet?
Ultraviolet therapy, it's with the ozone. It's a power light, medicine. So we take the blood from the patient into the sterile empty bag, okay? So we're dilute with the saline solution, and we don't use heparin. Heparin is not good for the people. That's
Why do you not use heparin? Tell us again.
Well, we don't use the heparin because they have a side effect for the people who has some certain condition. But majority people has the like a hemorrhage inside the blood cells. That's
so what do you use instead of heparin?
Sodium citrate. Sodium citrate, it's expensive, but we're using the sodium citrate because you have to prevent from hemolyzed blood, okay? So we use this saline solution mixed with the blood, go through the our pump machine. That's from IV blood going from the vein, blood going into the back. I'm gonna sit up right now because we have a patient and he can actually give you testimony as well. And then when the blood coming out with the ozone, we use this from Spain, that generator, which is amazing generator because they has a calculator inside, and we have a
Why is the calculator important?
Important because we have to know dosages what we administrated to patient, because everything about dosages, you treat several conditions, but dosages, it's number one important for individual people. You cannot take the protocol for everybody the same.
Which is what a lot of clinics do.
That's a lot of clinics do, and my husband David and I, we train in Europe, and they follow the only declaration what we're supposed to do. You can see how we use syringe, okay? So we use the syringes for ozone, and you can see this machine has, for instance, screen continuous ozone, manual for bag, because for bags we also use for like a trauma or open wounds ozone. We use that also help with the prevent the disease infection. So that's how we are introduced right now, and we can prepare that. So what we do, I need to yes, and blank windows. Ah, you give me two. I'm gonna teach people who is interested how to do the nurses and paramedics. Definitely welcome.
So nurses, functional medicine doctors, acupuncturists, anybody who could do infusions can learn this.
Yes, yes. Well, like I mentioned to you about acupuncturists have to have some certain training, and they have to be, like I said, it's a gray area, you know. Have to be careful with that. But our clinic is safe because, like I said, we have a medical director and nurses doing this procedure. But I'm just
So you're just filling this up?
So right now I'm filling up to 60 ml of the saline. Okay. Then I take the sodium citrate. Okay. And we are put into the empty bag. Let the bubble out. Close. Clean. So we prime line through the UBI. It's right here, I prepare already, and we put inside the UBI machine. Line from the patient this direction to the back. Put inside.
So this is another type of UV light?
It's no, this is the peristaltic. This is machine which is helping to take blood out, in. You know how the 10 passes machine do vacuum, step the vacuum. This machine and that Ukrainian machine from Europe also doing the peristaltics. If you see this like a ribber, like ribs, this machine work like our intestine work. You know, peristaltics in moving the blood gently.
Okay.
No vacuum, no suction from the vein, which is safe for our veins. Now it's ready, so we're waiting for patient and he is coming. We can do the UBI procedure. We take the blood out and in and put through the UBI, and we turn on that machine like this, so it's basically light on. Okay, and that procedure take like about 45 minutes. This is major auto-hemotherapy with UBI light when we're doing procedure. This is advanced therapy for people who's reduced the oxidative stress from the body. So we doing this the 120 ml of the blood and mixed with the 120 milligrams of the ozone into the empty bag, and we are going through this whole system, and that system gentle pumping the blood. It's not like suction or vacuum. It gently taking blood out the vein. After that, when we already get a certain amount of blood, we have to stop, and we already see this difference between this blood, which is the black, and that blood, which is the ozonated. It's light, bright, and full of the oxygen and ozone into it. So now we bring this blood back to the patient. So how we do, we have to change our direction of this peristaltic machine. So we change direction, and blood start going to the patient. And you can see how the blood going to start change from the burgundy color to bright red. Then we connect with the UV, and actually this is a little bit tight, but you can see already difference. Blood from here to here. And now when soon as this blood coming, remember, I'll go to this, soon when there's blood coming, we're gonna start UV light, okay?